November 1941. A 23-year-old woman is wheeled into an operating room in Washington, D.C. She comes from one of the most powerful families in America. Her brother will become President of the United States. Her father has been told she suffers from mood swings and mild rebellious behavior. Nothing more than what millions of young women experience. But her father wants it fixed. So a doctor slides a blade into her skull, rotates it, and severs the connections inside her brain. When Rosemary Kennedy wakes up, she can no longer walk. She can no longer speak in full sentences. She can no longer feed herself or use the bathroom. Her mental capacity has been reduced to that of a 2-year-old child. She will remain that way for the next 63 years. The procedure that destroyed her is called a lobotomy. And Rosemary Kennedy was not alone. Between 1936 and 1967, doctors performed this operation on over 50,000 people in the United States alone. Thousands more across Britain, Scandinavia, and Japan. The man who popularized it drove across 23 states in a van, performing brain surgery in hotel rooms, offices, and hospitals without surgical gowns, offering it the way a salesman offers vacuum cleaners. The inventor won a Nobel Prize, and for 3 decades, the world called it medicine. This is the story of the most barbaric medical procedure of the 20th century, and the doctors who believed they were saving the world. Before the lobotomy, there was nothing. No pills, no therapy, no understanding. If you developed a mental illness in the early 1900s, your family had 2 options: hide you or send you to an asylum. And the asylums were not hospitals. They were warehouses for human beings. Patients were chained to walls, locked in cages the size of dog kennels, dunked into ice baths without warning, strapped into spinning chairs until they vomited, or injected with insulin until they fell into a coma. These weren't punishments. These were treatments. By the 1930s, psychiatric institutions across America and Europe were overflowing. There were more patients than beds, more beds than staff, and absolutely no cure for conditions like schizophrenia, severe depression, or bipolar disorder. Doctors were desperate. So when a solution finally appeared, one that promised to turn violent, uncontrollable patients into calm, quiet, obedient citizens in under 10 minutes, without medication, without therapy, without even a proper operating room, no one stopped to ask what it would cost. The medical community didn't just accept it, they celebrated it. Then, in 1848, something happened that changed how scientists understood the brain. A railroad worker named Phineas Gage survived a 13-pound iron rod blasting through his skull, entering below his left cheekbone and exiting through the top of his head. He lived, but his personality was destroyed. The man who had been calm and responsible became aggressive, impulsive, and erratic. For the first time, science had proof. The front of the brain controlled who you were as a person. Damage it, and you damaged the self. That idea would sit quietly for almost 90 years, until someone decided to weaponize it. In 1891, a Swiss psychiatrist named Gottlieb Burckhardt cut into the brains of 6 patients suffering from hallucinations and violent outbursts. He removed pieces of their cerebral cortex. 1 patient died within 5 days. The rest became quieter, but also suffered motor weakness, seizures, and the inability to understand language. When Burckhardt presented his results, the medical community rejected him. The idea was buried. Until 1935. At a neurology conference in London, researchers presented findings from chimpanzee experiments at Yale. A female chimp that had been aggressive and frustrated before surgery became calm and cooperative after her frontal lobes were removed. Sitting in the audience was a Portuguese neurologist named Egas Moniz. Within 3 months, he performed the first human leucotomy, drilling holes into a patient's skull and injecting ethanol to destroy the nerve fibers connecting the frontal lobes to the rest of the brain. Moniz operated on 20 patients. He claimed 7 were cured and 7 improved. Critics noted that patients returned from surgery diminished, their personalities flattened, their spark gone. But Moniz didn't care about spark. He cared about silence. And in 1949, for this work, he was awarded the Nobel Prize in Medicine. One of his former patients disagreed with the committee's decision and shot him multiple times. Moniz survived, but spent his remaining years in a wheelchair. Enter Walter Freeman. He was not a surgeon. He had never held a scalpel in a real operation. He was a neurologist, a man trained to diagnose, not to cut. But when he read about Moniz's leucotomy, he didn't see a medical procedure. He saw a product. He partnered with neurosurgeon James Watts, and in September 1936, they performed the first lobotomy in America, drilling 2 holes into a woman's skull, inserting a blade called a leucotome, and rotating it to carve through the white matter connecting her frontal lobes to the rest of her brain. She survived, but she was no longer the same person. Freeman wanted something faster. The drilling took too long. It needed an operating room, anesthesia, a surgical team. He wanted a procedure any doctor could perform in any office, on any patient, in under 10 minutes. In 1946, he found his answer in a kitchen drawer, a standard household ice pick. He drove it through the eye sockets of corpses until he perfected the angle. Then he tried it on a living patient. He called it the transorbital lobotomy. The patient was knocked unconscious with 2 jolts of electroshock, 100 volts through the temples. Then Freeman lifted the eyelid, placed the tip of the ice pick just above the tear duct, and hammered it through the thin bone behind the eye socket. 5 centimeters into the brain, rotate 40 degrees, push deeper, rotate again, both sides. 10 minutes. His partner Watts watched the first transorbital procedure and called it revolting. He ended their partnership. Freeman didn't care. He invited journalists to watch. He posed for photographs mid-surgery. He performed lobotomies in hotel rooms, in state hospitals, sometimes 20 in a single day. He operated with both hands, 1 ice pick in each eye socket, 2 patients side by side. He wasn't practicing medicine, he was performing. Freeman marketed lobotomy as a miracle, barely more dangerous than pulling a tooth. Doctors believed him, families believed him. One of his patients was a philosophy professor with a PhD who had developed paranoid schizophrenia. Before surgery, the man could still speak, still think, still recognize the people around him. Freeman drove an ice pick through both sides of his brain and declared him cured 2 weeks later, because the man smiled and made small talk. He never taught again. He never wrote again. He never thought the way he once did. He didn't stop at the sick. He lobotomized women whose only symptom was arguing with their husbands, women who failed to keep house. 84% of lobotomy patients in one European study were women. Lobotomy wasn't just medicine, it was control. He lobotomized children. The youngest was 4 years old. In 1960, a 12-year-old boy named Howard Dully was brought to Freeman, not because he was mentally ill, but because his stepmother didn't like his personality. His symptoms were daydreaming and turning the lights on when the sun was out. Freeman drove the ice pick into both sides of his brain. After the surgery, Howard was thrown out of his home, spent years in institutions, and battled addiction for decades. He later wrote, "I'll never know what I lost in those 10 minutes. By some miracle, it didn't kill me, but it did affect me, profoundly." Freeman described his ideal result as a patient with the personality of an oyster, smiling, obedient, empty. One man came out of surgery pouring coffee from an empty pot, unable to remember his own name. Freeman called it a success. Freeman toured the country like a traveling salesman. He bought a camper van, loaded it with ice picks and an electroshock machine, and called it the Lobotomobile. State hospitals would line up patients and have them ready when he arrived. In West Virginia, he lobotomized 228 patients in 12 days. In Iowa, 50 in 4 days. One afternoon, 24 patients, one after another, assembly line brain surgery in a hospital corridor. He operated without surgical gowns. He invited journalists and photographers into the room. During one operation in 1951, he paused mid-surgery to pose for a photograph, and the ice pick slipped. It went too deep. The patient died on the table. Freeman pulled out the instrument and moved to the next one. But the world was catching up. In 1950, the Soviet Union banned lobotomy entirely, calling it contrary to the principles of humanity. In 1952, a French psychiatrist introduced chlorpromazine, the first antipsychotic drug. It worked better than any ice pick. It didn't leave patients as empty shells. The age of the lobotomy was dying. Freeman refused to accept it. On February 16, 1967, he performed his last lobotomy. The third operation on a woman named Helen Mortensen. She died of a brain hemorrhage on the table. Freeman was banned from every hospital in America. He spent his final years driving across the country, knocking on doors, visiting former patients, trying to prove his procedure had worked. Most of them didn't recognize him. He died in 1972, alone, still convinced he had been right. Between 1936 and the 1980s, an estimated 50,000 people were lobotomized in the United States alone. Roughly 490 of Freeman's patients died on the table. Thousands more were left permanently disabled, unable to think, speak, or recognize their own families. Today, there are ongoing petitions to revoke Egas Moniz's Nobel Prize. None have succeeded. The tools Freeman used are now behind glass in museums. The patients he destroyed are mostly forgotten, and the question that haunts this entire story remains. If a doctor tells you that driving a steel rod through your eye socket will cure your sadness, who exactly is the one that's insane?